Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank all of our listeners for tuning in to SGMC Health's podcast and for liking, sharing, subscribing, all of those great things.
And if you have any questions or topics you'd like to submit, you can do that at sgmc.org/podcast.
And today we are here with Dr. Elizabeth Pittman and soon-to-be Doc Chris Harvey. And they are with our Mercer University School of Medicine program. And so we'll start with you, Chris. What brings you in today?
Yeah, we're here to talk about our experiences here at South Georgia Medical Center as medical students and furthering our medical education.
Awesome. So just a little background information. SGMC Health entered into a partnership with Mercer University School of Medicine back in, I would say, 2019. And that was really to launch our residency program. So we kind of partnered with them. They were able to help us start an internal medicine residency program. Which is we're graduating our first class in July. And then we have several other residencies, family medicine and internal medicine, that have since come. But then also we most recently, I think last summer, we became a clinical campus for third and fourth year medical students. And so that's kind of how y'all got to SGMC Health. And so maybe just start out first with... Tell us what happens when you decide, hey, I want to be a doctor. What does that look like?
So I guess for me, it looked a little different. I actually started my career in medicine here at SGMC. I was a candy striper. I did the canopy of care as a middle and high school student. I'm just kind of volunteering, trying to get my volunteer service hours. And I didn't really know that I was interested in medicine, but once I got involved with patient care and really seeing that I could make a difference at such a young level, I was really interested and wanted, to continue my service in that career. And then I actually chose Mercer for undergrad because they had a medical school, and I felt like that connection, the medical school is so involved with the undergrad campus, with the master's programs at the medical school that you really feel like a family early on, and they can kind of help guide you in your career. So I guess that's kind of where my story started. What about you, Chris?
Yeah. Mine's all over the place, it seems like. Medicine is in my family. My father's a physician. So that kind of started a little fire a little bit. Really didn't know what I wanted to do after graduating high school, so I spent a summer kind of watching what he did. And that planted another seed. That wasn't really where I was sold, and it wouldn't be until about my third year of undergrad, and I went to Georgia College, where I just was miserable in my major and just, peeled off the Band-Aid and said, I'm going to change it. I'm going to do it. I'm just going to go for it. And, and I never looked back. And
I feel like when someone think deciding what you want to be as a career, and especially if you're not like just adamant, like, hey, I want to be a doctor, it can seem, I feel like it would seem a little overwhelming because it is a career that requires a lot of education.
Yeah, and that was one of the things for me that was the holding back part, is I never really pushed myself in an academic setting per se. I didn't take the honors classes in high school. I didn't do all these other things. And so I kind of had this reluctancy. And there just comes a time where when you know, and that was it for me.
And I think it's also a little bit different. Like, I'm the first doctor in my family, and like anyone in medicine, really. So I think there's a lot of hurdles that you don't see going into it. Like, you don't know about, all the extracurricular activities that will look great on a medical school application. Whereas, your dad might have told you, like, hey, this would look better than this, service or these things that matter. But I feel like now, on the other side of things, I've been able to use my career path to, kind of inspire and talk to other students that say, hey, I'm interested in going to medical school. They might be in high school and, college, and they've just been able to ask me, what do you think is important? Do you think this opportunity is important? Do you think, I should study for the MCAT right now? What do you think about these things? And I think that is an unspoken, role that we play as medical students, or that you inspire the next generation, not just when you're a physician and when you're letting students shadow you, but now, people are looking to us and asking these important questions and they're career-changing questions, if you take the time to, take the 5 minutes and say, hey, I'd love to help you. Here's my number or here's my email. ask any questions.
It's kind of that theme, like if you can see it, you can be it, like what you're around growing up. So we often hear of physicians that become physicians because their family, they had some physicians in their family and they saw it. So it was more, it was more realistic to them because they could see it as an end goal, whereas people that don't have access to any physicians maybe in their childhood or that you just don't really think about that as much because you don't see it. So I do think that's one of the benefits of having students here at our organization is it certainly can be a launch to inspire other people to go into medical education. So that's cool.
Definitely. So what was your experience as far as, I don't know how it works. Do you pick to do your clinical rotations at SGMC Health, or do you have other options? Or if so, why did you pick to come here?
So from the beginning, I guess my experience is a little bit different than Chris's because we were kind of in the shift of everything happening. So for my experience, when I got in, depending on when you get accepted to Mercer, you pick your campus. So you can pick Savannah, Columbus, Macon. My class was the first class to have a full 4 years in Columbus. Before it was like Valdosta, it was just 2 clinical years. So you could pick any campus, and then there wasn't, we had talk about Valdosta, but there wasn't anything, substantial here as far as us, like, coming and staying. The class above me could opt, like, I know Dr. Fricker's daughter came, and she did a couple weeks to be with her family, and you could do things like that, but there wasn't really like, oh, you're going for this rotation and you're getting these credits. It was kind of like a, offshoot of 4th year if you wanted to do an elective or not. So they told us that we would be going for at least 2 weeks. We didn't know what rotation we would be going on, and later we found out in the scheduling. And then it just kind of became like this wildfire that, like, you couldn't put out. Like, the students that were, wanting to go into OBGYN and there was no residents here, they were so excited. We love our residents, but coming here and getting that, be able to be the first assist in a C-section, where we didn't get that kind of, hands-on treatment in Macon. And if you did, it was, there are residents that are learning the specific field, and you might just be a student passing through, and you might not be going into that field. You might be going into internal medicine, where you're not going to ever deliver a baby. So it kind of, ignited that fire for some students that they really got that, first experience, or like the pediatric experience was great. I've heard so many good things, and I didn't get to experience all of them. But I did come for internal medicine, which I loved, seeing a different residency program than the one that we were a part of in Macon, seeing how, the program works if you only have 2 years of residence, seeing how a program really starts and what was important, in the values of starting here at the SGMC program. And then for me specifically, they offered, if you would like to go for more electives, because they've heard, such great things, if you would like to go for more weeks, you can do that. We will happily, fund you to go back to Valdosta. So I actually wanted to come back for surgery, and I came for 2 weeks and worked with Dr. Brown and Dr. Johnson. And then 4th year came around, and we were allowed to do, sub-Is here, sub-internships, which is a huge, 4-week elective that you're required to do for graduation. So you could do that here. You could, if you want to go into rural medicine and that you want to go into primary care and you wanted to see that setting and get experience now before residency starts, you could come here and do that. And it was just an awesome kind of extension of the mission for the school.
Yeah, mine was a little different. When my class, I'm just 1 year behind Dr. Pittman. And when my class came, Valdosta was now officially a 2-year part of this picking of the campuses when you first get in. And I got in off the wait list with about a week to start medical school.
Wow.
And so I was told I was going to do the first 2 years in Macon, and that the last 2 years would, because they were still in the midst of really trying to figure out what they could and couldn't do fully as far as a full requirement for third-year rotations here. But that third year would look a lot like just being in Valdosta for most of the time. And so I knew from the get-go that I was going to come down here. And any time that you're going to move in the middle of medical school or move in the midst of anything, really, there's a lot of animosity and a lot of unknown. And a lot of the students that, that are here now that came with me were a group of us from Macon, Columbus, and Savannah. And it's a pretty homogenous bunch. There's a lot of reluctancy and a lot of fear in that. And so I felt in my position, it was whenever there is this reluctancy, there's also an opportunity for growth. And so it was one of those things where I dove straight in, wanted to make this the best thing that it possibly could be, and signed up, all in just about from the get-go. And yeah, that's how my experience getting to SGMC was, and a little different, but...
Yeah, I'm sure that can be very scary. And I have often thought, we announce our match every time we have a residency program that matches. And it's always like, wow, they're just figuring out where they're going to spend the next 3 years of their life often. And that's such a big decision. And you don't really even get a choice oftentimes with that. I mean, you have a little say, but you don't know until that paper comes back. So it's exciting that y'all were able to come here. And I like what you said about just like going all in and making it the best experience you can. I feel like we have to do that every day in our lives. That change is a given. That's the one thing that doesn't change, is that change is there. So I like that attitude and just embracing the unknown and going forward and making it the best you can. Mm-hmm. So I think that will make you a successful physician. But tell us a little bit about your specialties and what you're looking at specializing in. So you go to medical school, then you decide what you're going to do for your specialty, and then that leads to the match day, which I kind of just referenced, and you just matched this past March. So tell us about where you matched and kind of what your next step looks like.
Yeah, so I actually matched in Birmingham at UAB. I'm going to be going into emergency medicine. And then after, I'll be coming back to the Valdosta area to work.
Very good. And you said emergency medicine?
Yes.
Yeah. Okay. So, and we'll have a nice building.
Yes.
We'll have a brand new, shiny ER that will be waiting for you when you get back. If you want to come here. I know we also have rural community ERs as well. What about you, Chris?
Yeah, I'd like to end up in surgery. Mm-hmm. What specific realm so far, I'm, not 100% certain, but I'll go through the general surgery route. And that's been a great part of being here, is I have really gotten to explore surgery to its fullness, really getting to iron out why I would like a certain realm of surgery. It's hard to say whether you would or would not if you're standing in the corner. But when you're scrubbed in and you're right there in it, and you get to really understand what this specialty is in the surgical world, you get to explore that in a much deeper way than most people really get to by the time that they've got to, solidify and do the match. And so I'm very thankful to have been able to do that here. And it's made me realize that starting in general surgery, there's just such an open realm of possibilities and such a greater continuity of care. Even some of the guys like Dr. Johnson that's here, when he does cardiac surgery, also will do different surgical care for his patients, ones that he's worked on before, and that's because he went through a realm of general surgery. And so, that's the trajectory for me at this point.
Okay.
Are there any specific moments about your time here at SGMC Health that have stuck out, like any cool procedures or cases you got to be a part of?
Yeah, so like Chris was saying, in the different, clinical areas that we can go into, Columbus, Savannah, Macon, they all do have surgical residencies. And so that was part of the reason why I came for surgery, is everybody said, surgery in Valdosta is so much fun. You get to do hands-on stuff. You get to do more of the procedures. You get to do more of the aftercare. Just felt like you were, you had a place, you had a role to play in the operating room, which we often don't, get to feel, like Chris was saying. We kind of, sometimes you'll stand in the corner. There's so many people at the table. It's really hard, to learn in that aspect. But here, I remember when I was here for internal medicine, it was great. I was just starting out. I had so much fun with the residents. I had so much fun in the outpatient clinic, like the way it works. Some of the residents taught me how to do IVs. It's just a cool thing you don't think about, when does a doctor learn to do an IV? So that was really special to learn it here and just have a lot of time for them to help me practice. But one of the coolest experiences that I'll never forget was I was in my first surgery, open heart, bypass surgery with Dr. Brown. And he was like, hey, come here for a minute. And I was like, oh gosh, what is he about to ask me? What is he about to say? And he was like, I want you to feel this. And I actually was scrubbed in, and I got to hold the beating heart in my hand. That's just a moment you'll never forget.
Yeah.
Going off of that, so Dr. Brown and Dr. Johnson were in practice with my dad for years in Macon before they came here.
Yeah.
So just an overall amazing experiences getting to work with Dr. Johnson.
Yeah.
Someone who I've known essentially my whole life.
Right.
And has known me from the beginning, and getting to really experience that, to where he's even accidentally called me my dad's name before, because it's just like, that just really brings it back.
Yeah.
And so it's really funny to have gotten to experience this, someone who, him and my dad trained together as well. Mm-hmm. So getting to, get this whole full circle experience, for me, that's just, you can't put a price tag on that.
Yeah. That's awesome. There's so many, I say it's a big world, but it's actually very small, all the different connections. And that's what I love about being a part of Valdosta is it's not too big, but it's still big enough where there's things to do, a lot of amazing things happening, specifically in our healthcare arena. Advancements that are being done at bigger facilities are being done here. But yeah, you still have that kind of small town feel to where having a culture that's collaborative and supportive. And I think that's one thing, even before y'all got here and even before our residents got here, that our leadership was very adamant about, was that we want a culture that is very accepting of students and of education, because it's important. I mean, that's our next generation of care, and that's going to be our next, workforce. But making sure that y'all have good experiences here, because ultimately we'd love for you to come back here and continue to serve our patients. But you're part of the team. You're not just like someone that's sitting in the corner watching something. That's what we certainly aim to strive to do. So, and I'm not clinical, so I don't know that happens, but I'm hopeful that does. So it's good to hear that from y'all.
I can personally say that, and I've done the full breadth of the rotations here. I'm currently on my last core rotation, and I can't say that there's a single rotation that I've been in thus far where I did not feel like I was truly involved in the process. And you can only speak to what you've experienced, and I don't know exactly what the experience has been of my other classmates at the other campuses. I don't know how I would have been in those positions, but I can say for a fact that I felt like I truly was making differences as a third-year medical student, which I will say I do think is not commonplace.
Yeah. And I'd love to give Mercer a plug, because, their whole mission is to develop physicians to serve Georgia, and they have been a huge partner in the development of our medical education. But what made y'all decide to choose Mercer University School of Medicine?
Well, for me, being from Macon, it was right there in the back. I grew up going to camps at Mercer, and you kind of get to rank where you want to be, but it'd be pretty cool to go to medical school where you grew up and not have to worry about a whole lot, and that worked out very well for me. And Mercer's just always been a staple, especially when you grow up, born and raised in Macon. That's second nature to you. So that was one of the big driving forces for me in picking Mercer.
Yeah, I'm actually a triple bear, so I have graduated from Mercer 3 times. So Mercer was kind of the theme. This is my 10th year actually in Macon, so it's kind of hard to break the mold after you've been there so long. But Mercer is the reason that I chose Mercer, the medical school, is the reason why I chose Mercer for undergrad, because I was here, for my whole life, and I remember my principal one day said, Mercer is the only school that's on your list of colleges you want to go to that actually has a medical school on campus. Why would you not use that resource? And then I remember I did a little work with telehealth and interned with them in high school, and that really got me in the door, through Mercer, because I was, they prioritize it so much. We actually have classes, and we collaborate with the telehealth team to use the facilities. But Mercer ultimately stood out to me because they are one of 2 universities for medicine in the nation that actually take your zip code into account. So being from Nashville, Georgia, my whole life, that really was another number on my application that played a huge role. Instead of just my MCAT score and my grades, they also cared about my experience and my roots in rural Georgia, and that was really important to me to, add to my career.
Yeah, because it's hard to, in my experience here at the health system, I've been here 13 years. So the first part of my career, it was hard. It seemed hard, like challenging to get physicians to come to our area. It's just nearly impossible when they do residency. It's other places that are bigger and they get involved in that health system and they connect and they build those connections and they want to stay kind of close to where they've done that. So that was difficult. Now, obviously, with having all the residency programs here and just having a better culture, and we have a great medical staff who many are graduates of Mercer University, a huge Mercer graduate base from Mercer, which is why we wanted to partner with them to do the residency programs in the medical school. But now we're starting to already just, 5 years into the relationship, we're just seeing so many physicians join our team because of that connection. So it's interesting to see how it plays a bigger picture in the whole access to care in Georgia by having these partnerships. So
Definitely. Do y'all have any advice for other Mercer or medical students that are heading into picking their clinical rotations or, deciding on where they would like to go for a residency or anything like that?
Yeah. I feel like I would say, a lot of, 80% of my class just matched into primary care. So I think primary care is a huge lure for Mercer. That's what, the students are attracted to, that they prioritize primary care physicians. And I think that if you were, at Mercer and you were looking to go into primary care, if you're looking to go to medical school at all, I would say, come to Mercer, take a rotation in Valdosta, because I really think that, like Chris was saying, you get so much hands-on care here of the patients and you can really make a difference. And, being from here, I know how great the community is and how much they love working with students. Like, I've never been, shut out of a room or told no. They've always wanted to talk to me and hear about my experience. And I think that is such empowering thing as a student. You feel important, you feel like you're needed. But I think this gives a really great picture of what you're looking at going into a true primary care office, not just a residency program that has a huge hospital that has all this access to resources, but understanding that you're in an area that doesn't have as many resources and you have patients that also can't get access to things, and you become so creative and you find different ways to achieve the same goal for them, and you really become a part of their family. Our keynote speaker at graduation last weekend, Senator John Kennedy, said that his dad was a primary care physician in a rural area, and he said that he was invited to weddings, birthdays, to speak at funerals. The primary care doctor just becomes a part of the family. And I think I really, really saw that when I was here in Valdosta. And I think if students really want, a taste of what that looks like or want to be immersed in a community, to come here and do a rotation, and they'll really see, how much they are needed.
Yeah, I can't second that more. I worked in an OR during summers once I decided in undergrad that this is what I wanted to do, and worked in an OR in Gwinnett County in greater Atlanta area. And, and Macon's it's like fourth or fifth largest town in Georgia. Columbus is a big town. Savannah's top 3. And so some of these other places, you get to see a different patient population, but rarely are you going to get an opportunity to be at a place like this where you truly get to see what serving rural Georgia can look like in a full hospital system. And so it's very unique in that aspect, where this hospital system feels big, but it serves small, but it serves a huge need. Yeah. And so I think being able to experience that, having seen what greater Atlanta medicine also kind of looks like, you just really develop a different type of relationship with the people you work with the families that you serve. Because when you serve a patient, you serve their family too, whether they're directly in the room or not. And that cannot be more true about the patients that you serve here in rural Georgia and at South Georgia Medical Center.
It's the culture. I love what you said about like the community and stuff and being welcoming. We hear that all the time when once we get physicians here, they're like, oh, we love it. You know, we love the culture of the system, but even the communities and stuff, it's just a special place, I think.
Is.
And I don't know how to describe it, but it just is what it is. And you don't know till you've gone other places, I guess.
Yeah.
And so,
Yeah, exactly.
And like you'll have an opportunity this year to do away rotations and
Yeah.
kind of see different hospital systems, and that's how I kind of chose my place for residency. Was last year I was looking for something that felt like home, the way Nashville Valdosta has felt like home, the way everyone is so happy to see you and catch up. I mean, I saw so many of my neighbors in the lobby this morning, but I was looking for that, and I think Mercer does a great job of mirroring that community. You know, like Macon is bigger, but I feel like the school itself feels like a small community, and
Right.
you just feel so welcomed, and you know that's what makes it so hard to leave. But I was looking, and I didn't really realize how special that was and how unique it was until I did away rotations, and I saw there were other communities that, you know, you weren't as prioritized and you weren't as, you know, cared for, and it was very standoffish, and, you know, people didn't get to know each other, and, you know, it was just a harder community to get involved with if you really didn't already have roots there, and I think that's, you know, what also makes this special here.
all right, here's the tough question. What's been the most challenging thing about medical school in general?
Well, you've got the full 4 years,
Yeah.
so
I really think the adjustment from first and second year, the preclinical years to the clinical years is very hard. A lot of people say that it's, you know, residency is 10 times that much of a learning curve. But I think it's hard to go from sitting and studying for 8 hours a day in a library with your small knit group of friends where it's so quiet and peaceful and you can really get through so many practice questions and, you know, learn so much. I think it's hard going from there to learning in a fast-paced clinical setting, and you're learning from patients, and you're, you know, putting in orders, and you're writing notes, and you're trying to soak up every ounce of education you get every day, where you might not be sitting opening a book, really having it all laid out for you in a chapter-based setting. You're having to, you know, put bits and pieces together and mold it into your whole I guess rotation, and then take a test and say, okay, first, you know, I feel like for surgery, for example, I feel like I learned backwards, forwards in that rotation. And then like pediatrics, I feel like I learned front to back. And it's just a lot harder to, you know, learn the most complex stuff first and then miss the basics and have to go back and kind of, but I think that's what makes third year so exciting, because you never know what's going to happen and you never know what you're going to learn, and you have to go into every day and kind of dive in. Like Chris said, you have to dive in and take what you can get, and, you know, realize that you might only have an hour when you get home at night because you're exhausted and have had, you know, a 12-hour day, and you might just have time for just 5 practice questions, you know, like while you're eating dinner, while you're trying to fall asleep, you know, and first and second year, you have kind of unlimited time. We have free range of our schedule, kind of.
Yeah, you don't appreciate that time until it's taken from you. I would agree that transition from second to third year, at least, because I think the vast majority of people would say the first 2 years of medical school are kind of the ones that really grind your gears, because you aren't getting to be with patients as much as, you know, some you do in third and fourth year, and even if at all. Mercer does a great job of giving us standardized patients and incorporating that into the first year, so that when we get to third year, we can really kind of move along quickly and progress fast. But still, nonetheless, there is a different level of time that is taken from you, and it's a totally different way of studying. You know, reading from the textbook, doing this, doing that, sitting in a, you know, calm area. Whereas you might have to pull your laptop out next to a C-section like I did last night, you know, and just sit there and hurry up and get a few things in and then go into the C-section. You get it in where you can. But that being said, you learn from all of the people around you. You'd be surprised how many times what you see shows up on the test.
You're absorbing like so much from all different areas, all the different people and all the experiences, and having to catalog that and real time. Yeah.
But I think it's so underrated who we're learning from. Like, I feel like I've been reflecting a lot on that the last couple of months leading up to graduation, and I've been reflecting on who, you know, the residents and the physician, you know, attendings obviously teach you a lot, but I feel like it is Nurses Week, but I feel like we do learn so much from our nurses and from our techs and from other clinical staff, like practice managers, and we learn so much from them, that we might not know how to put on, like the wound vac correctly, and then the OR nurse is teaching you how to do it, and those are just things that, you don't realize that are so important, but until you don't have someone doing it for you, and I think that's really, underrated part of third year, too.
Yeah,
You're learning from not just your attendings and, the people that are, the doctors in biochemistry that really know every last detail of what you're learning. You're learning it from someone who's done it for, 20, 30 years. And that's super
I love that
important.
because
You
the
learn from
health
everyone.
system is so much more dynamic than like everyone always thinks doctors and nurses. Obviously, that's like the key careers in the health system, but there's so many supporting elements that are in that that make the health system run. So we couldn't do it without them.
And, like, we learn how to intubate, a procedure that, like, I'll be doing quite frequently in the emergency room. I learned how to do that from a respiratory therapist. You learn how to, hone your craft from people that, are specific to this area. And I think it's just so important.
Yeah, that's very cool. Thanks for sharing that because I hadn't even thought about that, but it's a huge role. So thank you to our team members who all
For
play
sure.
a part in this.
Thank you to everyone
into this
who has helped
educational
us get
program.
through.
Yes.
Well, we have to wrap up, but I have one last question. And it all depends on how much time you spend here, I guess. But what is your favorite meal to eat here?
Ooh.
In our cafeteria or in our allspice cafe?
I'm a big fan of the taco bowl days.
Yeah.
It's real easy, real simple. You can run through and you can take the bowl and just you sit down and eat. And that's probably my favorite.
I will say the breakfast in the allspice is second to none. I mean, it is just absolutely fabulous. But if I had to pick another meal, it would be the cheeseburger wrap.
Yeah,
Delicious.
the cheeseburger wrap is good. I haven't had that in a long time. You just reminded me about that.
All right. Well,
And we're getting close to lunch. So.
yeah, we definitely haven't had that answer. I think somebody has said tacos or taco bowl before, but interesting. Well, thank you guys so much for being here today.
Thanks for
you for
having
having
us,
us.
for sure.
And thank you to all of our listeners for tuning in. And just remember to like and subscribe. And you can submit your questions or topics at sgmc.org/podcast.